Hello friends, myself Dr. Mayur Saita, and here in this video we are going to discuss about the necrosis. So as it's a pathology topic and I have opened the book Harsh Mohan and I am teaching from the Harsh Mohan, so you do not need any notes for it. What is necrosis? So necrosis is defined as the localized area of the death of the tissue. Tissue is made up of the particular amount of the cells. So all the particular areas of cells are damaged, and if the cells are damaged there is multiple types of the enzymes, and those enzymes do the damage all over there, and so that the inflammatory reactions also occur over there. The neutrophils, macrophages comes and visit these places. So you can easily say that the necrosis is basically murder. Here the murder is a mass murder. Here all the tissue cells over that particular area are damaged, as well as plus it is accompanied by the inflammatory reaction. What can be the causes for occurrence of this necrosis? So most common causes are the hypoxia, there is a reduced blood supply to the particular part of the tissue, or some chemical or physical agents or some microbiological agents like virus, bacteria, fungus, or antigen antibody based reaction can also lead to the necrosis. Now based on this etiology means the reason, and the morphology means we see the organs with the naked eye, then it is known as the gross features. When we see after cutting the organ, H&E staining and then visualizing, that gives the microscopic appearance. So from that we see the five type of main necrosis, and the first which common type of necrosis is the coagulative necrosis. This is the most common type of necrosis, and the most common etiology for coagulative necrosis is the reduction of the blood flow through that particular organ. That means it's the ischemic necrosis. Which organs which are mostly goes into the coagulative necrosis? Then remember heart, kidney and the spleen. That means some solid type of organs mostly go into the coagulative type of a necrosis. And if you see that a particular part of the kidney or not getting the enough blood supply, then the grossly with the naked eye, when we see that type of kidney into the early stage, reduction of the blood supply make the kidney pale as well as a firm, just like we touch to our nose. It is a swollen also because of the occurrence of the accumulation of the fluid and edema. But as the necrosis progress into this organ becomes more and more yellowish, or you can say paler, and because of the hydrolytic reactions they becomes the soft, as well as the size is reduced, they become the shrunken. Now microscopically you can see the coagulative necrosis, a slide here. This part is the normal kidney and here there is a necrotic kidney, so that you can easily differentiate both. Here the proximal tubules and the glomerulus and the glomerular capillaries are well maintained. But as we see into the necrotic, here the glomerular capillary architecture, you can recognize that it's a glomerulus, but the cell size is slightly increased because of the increased fluid accumulation inside. As well as here you can see that the inflammatory cells, they are polymorphonuclear cells, as well as the macrophages comes here. So here the damage to the tissue has occurred. We can clearly see the normal part and this is the necrosed part. So into the coagulative necrosis, you can recognize that they are looking like the parent cell, but they are the swollen. And when we look at their nucleuses, there are mainly three types of changes which has happened. The compact of the nucleus, that is the pycnosis, fragmentation of the nucleus, karyorrhexis, as well as a complete lysis of the nucleus, that is the karyolysis. And eventually these inflammatory cells remove that dead cells, as well as they phagocytosed and remove them. Now the second most common type of necrosis, which is known as the liquefactive necrosis. This liquefactive necrosis occurs into the ischemic injury, bacterial or fungal infection. But here why the liquefaction occur? Then the answer is the hydrolytic enzymes are more and more released. Then those hydrolytic enzymes do the damage to the bacteria as well as our tissue cells. When the battle is going on and our border areas, then our soldiers as well as the opposite soldiers both are died and they are accumulated, you can say, and their dead bodies are liquefied, just like. So battle area, here it is bacterial, fungus, they are died and our tissues are also died. So that will produce like a abscess. So in any abscess, whenever you see any abscess, pus collection, abscess is a pus collection of the pus surrounded by the epithelium. So in abscess there is a liquefactive necrosis, as well as the brain is the soft tissue, and here the necrosis when occur, it is also most commonly the liquefactive type of a necrosis. So coagulative, how to differentiate it with, so here the grossly the tissue organ is a soft, as well as sometimes cyst wall is formed. What is cyst? Collection of fluid surrounded by the epithelium, and it is a pus, we also name is a abscess. And microscopically when we see here, there is a lot of phagocytotic material, inflammatory cells, fibroblast, which are proliferating over here. Now the third necrosis, which is known as the gaseous necrosis. Gaseous is just like a cheese. Outerly it is slightly harder, but inner it is a soft. That means you looks like you are a very hard, and but inside your heart is very soft. So just like that, you can say the coagulative necrosis is just like a dry cheese. And remember the example, it mostly occurs into the mycobacterium tuberculosis inflammation. And let's see the slide here. Here you can see there are more and more hydrolytic reactions which leads to the liquefaction over here. But onto the surrounding, you can see here the cells are flattened. In the pathology, whenever the small process also change, the name is changed. So they are actually macrophages, but their shape are changed because of the interleukin 1 tumor necrosis factor. The name is changed to the epithelioid cells. So here you can see epithelioid cells. They are the multinucleated giant cells because having the multiple nuclei. And surrounding by, you can see here there are the multiple polymorphonuclear cells. So inside it is a soft, outside the cells which make it hard. This structure is also known as the granuloma. But when you say it is a process, then it is a gaseous necrosis, or you can say it is a gaseous type of a necrosis. So microscopically you can easily remember that it is having the presence of epithelioid cells, which are basically modified macrophages. Now the fourth, so I just forget to tell, in the gaseous necrosis there is a both combination coagulative as well as the liquefactive changes. Now the fat necrosis, where the fat necrosis can occur. The organ which are having the higher amount of fat can lead to the fat necrosis. So anatomical, having a more fat present into the breast as well as into the ileum jejunum, which is surrounded by the mesentery over there, as well as in pancreatitis. All above them, acute pancreatitis is one of the most common reason for the fat necrosis. Into the slides also they have given the fat necrosis in acute pancreatitis, because in acute pancreatitis there is a release of the lipase which damage the lipid, do the release of the fatty acids and the calcium, and then calcium combines with the fatty acids and form the saponifications. And into the H&E staining, you can see like a cloud like presence over here, which resembles like a fat necrosis. In the H&E staining, you just need to differentiate the shades of the pink and the purple color, and just by looking those spreading of the pink color and purple color, you need to identify the organ as well as what type of the pathology has been happened. It is a very tough job actually. So into the fat necrosis, there is you can see grossly the organs are basically formed, but when you see microscopically there is a cloudy appearance. As well as the definition of the necrosis, they are also surrounded by the inflammatory reactions, presence of the neutrophils as well as the macrophages. Now comes the fibrinoid necrosis. In the fibrinoid necrosis, where occurs wherever there is a deposition of the fibrin tissue. So the fibers present mainly into the vessels. So most commonly fibrinoid necrosis occurs into the vessels. It occurs into the vasculitis, autoimmune diseases, Arthur's reaction. It can occur into the arterioles in case of the hypertension, peptic ulcer. What you see in microscopically into the fibrinoid necrosis, so you can see here there is a nuclear debris, and this is the presence of the multiple fibroid deposits. So there is a hyaline like deposits present into the vessel wall, vessels having the three layer tunica intima, media adventitia. So most commonly it damages occurs into the tunica intima over part, and there is a deposition of the hyaline like material. And When the vessels wall weakened because of this fibrinoid type of necrosis, then vessel may rupture and it leads to the hemorrhages. So when the fibrinoid necrosis occurs into the vessels and those vessels rupture, they may lead to the hemorrhagic changes. So that's how we have discussed the 5 types of the necrosis: coagulative necrosis, which is most common, liquefactive necrosis, abscess, coagulative necrosis, caseous necrosis, combination of coagulative plus liquefactive, then the fat necrosis and the fibrinoid necrosis. This is the end of the video. Thanks for listening.